Hello and welcome back to Cover Story. We are again joined by a very special guest. We are joined by Dr. Tickoo. He is the Director Internal Medicine at Max Healthcare Hospital. It's been a long while, Doctor, since we had you. I think in a way it's good because it shows that COVID, the wave is lessening. But it's good to be in touch again with back with you. And to begin with, we've been reading today about is there going to be a fourth wave? Where do we stand on COVID, basically?
Well, numbers are very low right now in India. Past few months, actually, post the Omicron wave, numbers are very less, and even the mortality is hardly there. There are no admissions happening. So even the virtual consults, even the ones who are actually getting infected are more or less getting better on their own. They don't even consult doctors. So India is doing pretty well at the moment. But yes, there have been waves going on in the rest of the world. If you look at Europe, if you look at France, Germany, Italy, South Korea, for that matter, Australia, New Zealand, the cases are going up and they're facing some sort of a wave there. So we are no different. And we've seen earlier how it can hit us. So we have to be vigilant. And if you look at Delhi, last 2, 3 days, the numbers have marginally gone up 100 odd, 120, 130, 150, 170. So that's why I think the center is just being proactive the way they've been with COVID earlier also. So Mizoram, Haryana, Maharashtra, Kerala, where the numbers are slightly going up, they need to be a little more proactive so that there is no sort of a wave. But having said that, the XE variant of Omicron, which is sort of creating a lot of panic all over the world, I don't think there's a cause for worry because there hardly been about 600 odd cases, and it's a subvariant of Omicron. Omicron anyway doesn't cause severe disease. It's a recombinant strain of BA1, BA2, which is a substrain of Omicron, and it anyway doesn't cause severe disease. But yes, it is 10% more transmissible. So in that sense, we'll have to be very careful, very vigilant, because life is back to normal. There's travel happening, there are flights happening, and somebody might bring it to our country, and then there might be a fear of people getting infected. See, if you're young, healthy, nothing will happen to you. You'll get over it soon. But it's again the people with comorbidities, if they catch it, they can get severe disease. But all said and done, we are in a good space right now. 2 years back when it started, and we've seen the journey, how it went, and Delta wave was pretty bad, and then the Omicron. And I think we are in a good space. We are doing well at the moment, and we are starting booster doses also, and everything looks good at the moment. But we still have to be vigilant. We still have to wear a mask. I would advise people still to wear a mask.
Yes, I was waiting for you to issue your statutory warning about the mask since we usually start our shows with that. But can we now call it an endemic? Because you've been saying that it's more transmissible, but it's not as deadly as serious. So are we heading towards that? Can we call it an endemic? Where do we stand?
Well, I think in India, we're heading towards some sort of endemicity. We're almost there because, see, endemic means we have to live with it. The virus will always be there, but there will be no large outbreaks or waves happening like you have with flu, chickenpox, or any other virus. They're always there, but they don't disrupt your life. So I think looking at the last 2 years and at the present moment, it looks like we are reaching some sort of endemicity and we'll have to live with it. There might be no future waves happening. But again, having said that, you never know. This virus always surprises us. So, though I'm not a big fan of these predictions, or these mathematical calculations which they do, and where they predict
which is what
these
I was
waves.
coming to, because there's a IIT Kanpur study, which you I think also must have heard about, which says that there's going to be a fourth wave in June, which will peak in August.
Well, I think it's very difficult to predict these waves, and the waves will only happen if there's a new variant, and that variant has to be more transmissible, more virulent, causing severe disease. See, with XE variant or some subvariant of Omicron, it's not going to cause a huge sort of wave in India because people have already had it. More than half the population is infected already, and then Omicron, so many people got it, and vaccinations, we've done it in a big way. So people are having some sort of immunity against COVID, and waves happening, unless there's a virulent strain, some monstrous strain which has hit us. I don't think we can really predict these waves. But then again, we have to be vigilant because it can happen. It's not done and dusted. We still have to look at the rest of the world, how they are still handling COVID. There are problems happening in Europe, even for that matter, US, UK, still having thousands of cases. We are having 1,000 odd cases, but that doesn't mean that we should get complacent.
Fair enough. What is the difference between the XC variant and Omicron BA2?
Well, BA2 is a subvariant of Omicron, and that's the most dominant strain in the world right now. More than 90% of the cases are BA2 subvariant. They're similar to each other with a little bit of difference. And this particular XC variant is a recombinant. It's basically a hybrid strain of BA1 and BA2. So BA2 is more dominant and it has characteristics of both. But having said that, for a layman, I would say it's more or less similar, but it just has 10% most transmissibility. But there are not too many cases. The first case was detected in UK in January, and it's been 3 months, and we haven't seen any sort of a wave. So I wouldn't read too much into it. There's no need to panic. But yes, as I said, we have to be careful. Cases might go up. So wear a mask and do the basics, which the government has asked us to do.
And the booster doses, I mean, I have some data in front of me which says, 60% of our population is fully vaccinated, 70% have got the first dose, but the booster dose, I think, is about about 1.6%. So the booster dose that has now started, in fact, today is the first day that, other age group is also getting it. Would you recommend that? And have you heard people getting after effects from the booster dose? Like, some people got from the first 2 doses.
Well, booster dose is recommended, and it's a big news, positive news from the government that adults will be getting it now, because there's a lot of scientific evidence which says that they do give you another layer of protection. It boosts your immunity against the virus, especially for the first 3 months once you get the booster, because the first 2 shots, though they do prevent severe disease, death, hospitalization, but over a period of time, 5 to 6 months, the antibodies wane. Though antibodies are not the only way to protect you from the infection, there's cell-mediated immunity also. But then there is no harm in boosting your immunity. And a lot of evidence now which says that you should take a booster, especially at least 5 to 6 months post the 2 shots which you get initially. In fact, some countries are giving the 4th dose also, the second booster. Israel started it, and even in US, the CDC recommends a 4th dose now for 50 and above. So it's after 4 months of the first booster. So I would say we also should do that, and that's what we are doing. I'm sure the government has looked into it. The advisors, the scientists have asked them to do this, and that is more than welcome, because we need another protection going forward in the coming few months. If there's another wave or this XE variant creating some sort of a increase in numbers, so we do need that protection, and boosters do protect you, give you another layer of protection, and I don't think there's any harm in doing this. But coming to the second part of your question, I haven't seen too many people getting any major side effects now post the booster, especially if you've had it in the past and you have not had a reaction. Very unlikely that you'll get a reaction in the 3rd dose. And but again, not many people have had the booster dose. I think 2.5 crore people in India have had the booster dose. But going forward now in the coming few months, because it will start in a big way from tomorrow, a lot of people will get the booster dose. Unlikely that there will be major events or side effects happening, because majority of the population, more than 80%, has had Covishield, and you have to get the same dose. That's the recommendation. So very, very unlikely that there will be issues happening. But I would say this is a very, very big positive move from the government to give another layer of protection to adults. In children, anyway, they are well protected. But even with children, the vaccination drive is going up in a big way. Even I think 85% and above have gotten their vaccination done, 15 and above age group, and in 12 to 14, some 45% have got the first dose. So I would say vaccination, India has done pretty well. I would say one of the countries which have done exceptionally well in handling this vaccination, apart from the way they handled COVID.
Another question that comes to my should booster dose now, be a regular thing every 6 months or every 8 months? Do you see that happening? Once we get our production
it all depends on how the situation evolves. The virus also evolves over a period of time. It depends on the scientific evidence. It depends on the epidemiological status, the local presence of the virus in the particular city. So there are so many factors, but maybe, yes, we would need some sort of a 6 monthly or yearly dose the way we do for influenza, for flu virus. But as of now, I can see that happening at least for the few years, maybe not in the future.
Yeah, one more question about the symptoms. I've been reading that the Omicron, whatever, is more gut intestinal symptoms rather than, early on, I remember the Delta variant was affecting the lungs more and pneumonia. So is there a difference in the 2 symptoms also?
Yeah, definitely. Delta was affecting lungs more. There were a lot of people getting pneumonia, drop in the oxygen levels. That's why there was a huge demand for oxygen and for hospitalization. But Omicron is a mild variant. It usually affects the upper respiratory tract. It doesn't go to the lungs most of the time. And so it causes sore throat, sneezing, some sort of irritation in the throat. So not many people would need hospitalization and things like that. But see, anyway, there is no specific treatment. So treatment is self-limiting. It's only even with Delta, when it causes complications, pneumonia, that's when you need the steroids, you need to be admitted. Otherwise, there is no treatment. Even now, we don't have any specific treatment, though there are certain antivirals, but we have to take it with a pinch of salt, how effective they are. But coming to Omicron, I would say the silver lining was that it didn't cause any severe disease. Hardly anybody needed hospitalization. It gave us some sort of another layer of protection, though it wasn't a vaccine per se, but it does end up giving the natural infection. Yeah, it does give you antibodies and protection. So it wasn't that bad, but Delta was pretty bad. Delta was horrible.
Yeah, Delta was, in fact, around this time last year. I can see a lot, people who are taking it easy are getting that warning bell again, because the timing is such that everybody's again, getting a bit worried that we are back to that season. I'm going to take a break and then come and talk to you at some of the learnings from COVID. How can these lessons be learned to handle other equally deadly diseases like typhoid, malaria, dengue, and also look back at the way India handled COVID. With someone, Dr. Tickoo, you've been with us since the day one, actually. So you are just the right person to actually chart out reaction to COVID and where we went right, where we went wrong, all that. But stay away after a very quick break. Hello and welcome back to a conversation with Dr. Tickoo. He's the Director Internal Medicine at Max Healthcare. We've been talking to him as to where we are on COVID, and also I'm going to now talk to him charting our reaction to COVID. Dr. Tickoo, it's been 2 years and you've been in conversation with us throughout. How has India handled COVID by and large? What would you say?
I would say India has handled it very well, exceptionally well, I would say. And the way it started on 2nd March 2020, we had the first case. And then I think the government was very proactive. They were quick, decisive. They took a call on the lockdown. I think lockdown was the key. And because of which we saved lots of millions of lives. Because we saw in Europe, US, what happened, for that matter, in UK also, so many people getting infected, the healthcare system almost getting collapsed. But the lockdown did end up saving many lives. Though there was an economic slowdown and things like that, and the migrants had to suffer, but there was no option left with the government, and lockdown did help us, and that gave us a window to ramp up the infrastructure. See, initially when we started, we just had a few labs doing the PCR tests. Not many hospitals were equipped to handle COVID patients, but that lockdown gave us that window to sort of prepare ourselves, increase the number of labs which are doing the test, get the testing kits, the PPE kits and things like that. So many things happened. And then over a period of time, when we had the first wave, it wasn't that bad. And we sort of were learning to tackle the situation. And then came the Delta wave. But before the Delta wave, vaccination had picked up. Vaccination had started. That was too early. It started in, I think, January 21. But we had just started and the Delta wave hit us. I think post the first wave, when there were hardly any cases, what happened that was we became too complacent. We thought that it's done and dusted, it's all gone. India, we have too much of immunity because we eat street food and things like that. All those malaria is endemic in India. That's why we are protected and things like that. But the second wave, the Delta wave, taught us a lesson, and it sort of exposed the loopholes in the healthcare system. So, see, people are so hesitant to go to government hospitals even now. What the learning is that we have to sort of bridge the gap between public-private hospitals, and our government hospitals should have state-of-the-art facilities, good infrastructure, the way it's all over the world, the way NHS handles it in UK or in America, though people have insurance there. So, but healthcare for all is what we should be working at. And that's what it taught us, the shortage of oxygen, the beds and things like that. I mean, it was horrible, to tell you the least. So that is the one learning that we should take from there, that focus on your healthcare. Previously, our governments have not focused on healthcare. And this government is proactive, decisive, and I think they should give priority to healthcare going forward. And that would really be the real learning experience from COVID. And then the vaccination drive, the way we handled vaccination and the testing. So India has done so many tests, COVID tests, second after US. Almost 79 crore tests India has done. And vaccination, almost 2 billion people have received a shot of COVID vaccines. Amazing. For a country like India, with the kind of economic resources we have, the healthcare infrastructure we have, vaccination was a big thing. I mean, hats off to the government for that, the way they handled it. Even now, they're being very, very active with it. And then the Omicron wave came, and though it hardly lasted a month, but the way they sort of kept on changing the situation, reviewing the situation, and taking a call on whether you need a lockdown or you don't need a lockdown, whether the malls should be open, the cinema hall should be open. I mean, you have to be at it all the time. And all the state governments, the central governments, they were working together. And that's what we needed at that point of time. There was no politics happening, and everyone was like supporting, everyone was together. And that's why we were able to handle COVID in such an exceptional manner. And we should give it to the government for that. And also our healthcare workers, everybody, the frontline workers.
Yeah, that's why I want to ask you about the healthcare workers, because how did the doctors feel? Because in the middle, there was some stigma. There was also, apprehension, and you were there on the front line. There was, of course, later on praise and applause. And, we had the Prime Minister also saying that everybody should come out and clap. But, initially, how you must be having your own fear and your own apprehensions. You were going to the hospital, coming home to your families. How did you live with that and the attitude of the public?
Well, there was always the fear, the apprehension of getting infected. See, you're exposed to infection throughout your professional life, but then this was something different. We hadn't seen anything like this. And the fact that you can give it to your family at home, your parents, grandparents, small children, and that was the fear. You don't really fear getting infected yourself. But then wearing the PPE kits and going to the hospital, and sometimes you were not able to see the patients for whatever reasons, and the other team would go in because you have to be out, you already been exposed. Things like that had never happened earlier. But again, I would say that was a learning, as in how things can unfold in future. It's so unpredictable. Anything can happen anytime. It taught us that. But again, it taught us to live and live in the moment. So that's what people have understood. And don't run after your, materialistic things, and take it as it comes and focus on your health. That is the most important thing, I would say. People would generally, there's not much awareness in India about getting health checkups done, getting blood tests done. And now suddenly everyone is, in the last 1 month, I've seen so many people now that earlier they were like hesitant, a lot of apprehension coming to hospitals because they would get infected. But not now anymore. I mean, a lot of patients coming for health checkups. Everyone wants to get a treadmill test, stress echo done, and cardiac status checked. Everyone wants to get their sugars, cholesterol checked. At least it has brought that awareness among people. And doctors have also learned the virtual consultations. That I think that was a big thing, big positive.
Yeah, telemedicine, I think, has got a big hit. For
the patients more than the doctors, because it gives you easy access to healthcare facilities. So you're sitting at home, even at 10, 11 in the night, you can call a doctor and you get immediate medical attention, advice, instead of running to the emergency and spending time there. I mean, I would say people are lucky in India, the kind of accessibility to healthcare system that we have in India. When Indians go abroad, they actually realize how bad it is over there. Even with COVID, in England, UK, or even in America, I have so many patients who live there who consulted me from there. They didn't have access to anything. It was difficult to get hold of a doctor, a general physician, or a GP there and get medicines, get advice, leave alone doing a CT scan, which is a big deal. There might be a waiting, they might not do it. But over here, it's so easy. I mean, still people say that India mein kuch nahi hota hai. I mean, if you ask for a CT scan in the morning, by afternoon, you have the report with you. That's amazing, awesome. And then they come back and show me the report. I tell them, do this. This happens in a day. It can happen only in India, I would tell you. It doesn't happen.
So are you still doing a lot of telemedicine counseling through videos and this thing, or have you gone back? What is the ratio?
Well, it's become a way of life. No, I wouldn't say we're doing the same that it was, because it was almost 60-70% of our work in the previous 2 years, especially during the COVID waves. But now I would say it's like maybe 10-20% of our work that we do. 80% of the work is now in the hospital, because that's how it ideally should be. This was a sort of a stopgap and the kind of, excess that people needed at that point of time. But even now, a lot of people, especially if it's not something life-threatening, if it's a minor infection or sugar or blood pressure, you don't have to examine a patient for that. You can just give them advice over the phone. So it has given them that window now, and that's the silver lining. And because people know now they have access, they don't have to go to the hospital, take an appointment, park their cars, spend 2-3 hours there. Somebody coming from Noida, Gurgaon to South Delhi has to spend so much, has to think twice before coming. But no more.
And what about the home test? Do you advise people, because how accurate are they for COVID?
Well, the rapid antigen test, if it's positive, it's quite accurate. But if it's negative, doesn't mean that you don't have COVID. But then again, we're not doing that much of tests now. Earlier, we would do during COVID waves, 50, 60, 70,000 a day in Delhi. Now we're doing 10,000 because it's not needed.
10,000.
And because it's not needed anyway. And there's no point in unnecessarily testing everyone. Now you're doing targeted testing. Somebody you really think has COVID, you test, and then he turns out to be positive. That's another reason why the positivity rate is a bit high compared to what it was previously, because you're doing targeted testing and the chances of them being positive are more. Earlier, we would test almost everyone who had flu-like symptoms. So
another fallout of COVID is what you may call it, the mental depression. That's become a huge fallout, of people, whether it was lockdown or actually having COVID and that brush with death. Is that rising cases? And would you advise, even the center or the government to focus more, because our mental health care is not very good, at least, for the public?
I completely agree with you. Well, the mental health has really taken a hit, especially with people staying indoors most of the time for the last 2 years. Even the children, they were not going to school, professionals working from home and not exposed to the outer world for majority of the time. It takes its toll on your health, mental health. And there's a lot of anxiety, depressive tendency, which has creeped in. I see a lot of patients saying post-COVID, this is how I feel. I'm not able to sleep, insomnia, panic attacks. People have lost their jobs. And then there's so many, life has gone upside down for a lot of people. So it does tend to affect you mentally, but things will get back to normal soon. And I think people should not be hesitant. They should talk to their doctors. They should seek advice, go for counseling. The psychologists do help you to get out of it. And sooner or later, you'll be out of it, because now that things are back to almost normal, hopefully there shouldn't be any future wave. And again, things will pick up. So nothing to worry, I would say.
Okay, on that very positive note, thank you, Dr. Tickoo. And I guess the biggest takeaway, is for that healthcare and health is something that is now totally on the priority list, even in a post-COVID era. That's something that you have really stressed on. You would agree, right?
Yeah, I completely agree with you. Healthcare should be our focus at the moment, and we should be ramping up the infrastructure of healthcare facilities, whether it's a private hospital, whether it's a government hospital. That's what our focus should be. India should be right up there along with the top countries which handle healthcare, whether it's UK, US. India should be next to them the way we are now in every other sphere. So we also should be there, right there. And I'm very sure with the kind of expertise we have, the kind of doctors that we have, and the government being very active with all this, I'm sure sooner or later we'll be there, hopefully.
On that note, I would also once again like to thank you for being there throughout COVID and for our viewers and helping us with the tips, symptoms, healthcare, what to do, what not to do. So thank you so much for that, and take care. And I'm sure we'll be having more conversations with you, hopefully on different topics. But thank you.
Thank you. Thank you so much for inviting me. My pleasure.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.